thank you guys for joining. My name is Will. I work for Aspen Dental Management. We are the support organization that supports the dentist-owned practices. We're currently at over 870 practices nationwide. We support the dentists anywhere you can think of, supplies, marketing, HR, just anything that can keep a doctor's focus on the patients. We want to take care of that for you guys and let you guys just focus on the clinical side of things. So I'm gonna let Dr. Fopp introduce herself, and then we'll get started with some of the questions you guys sent. So Dr. Fopp, if you wanna give us a little background, where you graduated from, where you're at now, and then we'll kind of get into your journey of how you ended up here.
Yeah, so I graduated from LSU School of Dentistry in 2012. I'm from Virginia Beach, so I've been back home since I graduated in 2012. I did private practice dentistry for my first 6 or so years out of school, maybe a little bit more now. And I've been with Aspen for about 2.5 years, I think. Depending on the math, I'm not very good.
So 2.5 years. So you graduated from LSU. Let's talk about, go back to your dental schooling.
Okay.
When did you start looking for opportunities? What part of your schooling did you start looking for opportunities?
Well, to be honest, it probably wasn't until a little later than most people would have, because I originally thought I was going to do an ortho residency, and I changed my mind just based off of my husband's job. So I was a little later in trying to find something. And for me, it was hard because living in Louisiana for the past 8 years and then trying to find a job back in Virginia, you don't have those connections. And that was 2012. I think they do a lot of things more differently now about helping students find jobs then. But it was difficult to find something. And that what happened to me is I kind of went out on a whim and applied. And you don't know those dentists, you don't know their work ethic, and kind of got in a bad situation my first job out. Yeah.
Okay. So you were considering an ortho residency. This is a question that just came in. If somebody's trying to decide between an associate position and maybe a GPR or AEGD, do you have any advice for that particular student?
You know, I feel like GPRs could be great. I just know a lot of people that went to them and they could have been doing it in the real world, because a lot of what they were doing in the GPR, they're not necessarily going to do in private practice. So some of the things like different sedation, I don't know, it could just be LSU's GPR, but there was things like IV sedation and different like hospital things. And that wasn't even something they were going to use. So instead of time in the real world, practicing, having a mentor for what you would be doing, they were kind of learning a lot of things that might not necessarily be applicable to what they'd want to do.
Yeah, I'd agree from what I hear. It's very specialized. So if you want to get your feet wet in a lot of different things, then an associate position might be right for you. We have Go Tigers, LSU Dental came on, so thank you. We also have Mississippi on, so appreciate you guys joining us too. This question came in, and this may be for me, but with some things that are going on with COVID, what are some things students can do for shadowing?
So I mean, I guess depending on how much you want to shadow, I recently just had 2 dentists that are in a GPR type residency up north, like at Rutgers, I don't know, in New York. And they were just at my office on Monday, shadowing me for a little bit, kind of seeing. So it's a possibility, because in a dental office, wearing your PPE, I'm not concerned with people.
Yeah, if you guys are interested in shadowing, reach out to me at the end of the webinar, and I'll definitely get you to the right person. We're still doing shadowing as long as you don't have any COVID symptoms. Right. We're going to treat you like a patient, take your temperature, make sure you haven't been exposed. But yeah, we'll make sure you guys can visit an office and see what you need to see, and most of the doctors, like Dr. Fopp, more than helpful to make that happen for you guys. Yeah. So would you recommend a new grad to work for private practice or a DSO first year out of school?
So I feel like that can be a loaded question, right? Because honestly, you've got to find your best fit. I don't care if it's private practice, I don't care if it's DSO or a residency. And not all DSOs are created equal. I've had friends work at quite a few different ones. Heartland, which Heartland offices are never called Heartland offices. They're always have a regular, like, generic name. I've had friends work for Cool Smiles, and had absolutely awful experiences. I will say all of my friends that have worked for Aspen, I had some friends when we graduated, the states they moved to had Aspen. Aspen wasn't in Virginia, except they just opened in Virginia about 2 years ago. But I've had friends in Florida that have been there since they've got out of school. I've had friends in private practice that they found a great place to work. For a lot of my friends, though, that wasn't the case. A lot of my friends, like me, we had to jump around from private practice to private practice, trying to find somebody who either we agreed with how they did dentistry, how they ran their practice, what was fair pay. There's a lot of different things involved in that. I think the biggest thing, private practice or DSO, is finding a dentist that you feel like does good work, and that you guys can work together. Because I worked for some people, I didn't agree how they did things. I thought a lot of things were unethical. They wanted me to do things I didn't agree with. So DSO or private practice, read your contract, make sure you can get out of it. I will say one great thing with Aspen, there's no non-compete. If you go work for them and it isn't your vibe, you can go work right down the street. That's a huge thing. But I've been happy. I haven't had to use that. So.
No, you bring a good point. Yeah, we don't do non-competes. We don't even do contracts. So, we have doctors that come in and, they want to go work right across the street. We just ask that you give us a little bit of notice because we want to do what's right by the patient. So, as long as we can find a replacement, we're happy to let you move on. But there's no contracts, no set of time you have to work for us, anything like that. So I'm glad you brought that up, Dr. Fobb.
Yeah.
This question just came in. What are some of the main differences between Aspen Dental and private practice?
Ooh, okay. So one huge difference, and I mean, that wouldn't be a concern to you guys right away, but Aspen's purchasing power, I guess you would say. I know we order through Henry Schein, and we have specific labs that we use for, like, crown and bridge, partials, things like that. We have our own denture lab, so that's not a big deal. But in private practice, the fees for labs and the fees for ordering from Henry Schein, Benco, you name it, I was awestruck when I did my first purchase with Aspen and saw the prices we got. And that makes a big difference in how you get paid. Private practice, Aspen, whatever, your budget, what you're doing. The same thing with sending crowns out, different things like that. That's a big difference. And I think CE and learning, because when I worked in private practice, they can your boss can tell you all they want, like, yeah, I want you to do CEs, but are they going to support you to do it? Are they going to, like, help cover the costs? Are they going to allow you that time off? And Aspen has wonderful CEs. So that's been a huge thing.
Yeah. I think I was on a phone screen with a dental student before today, and he asked me about CEs. And I used to work in an office and operations regional management, and there's always these CE emails going around that says, hey, free CEs, you just got to get there to the location, whether it's OS or ortho or whatever it is. There's tons of free CEs that are offered. So I'm glad you brought that up.
Yeah.
Let's see. This question just came in, and you may not know this, but I'm going to ask it anyways. Do y'all have any existing or general office related part-time jobs while we are in school?
That I don't know how that would work, to be honest.
Yeah, that's okay. So if there's an opening at a location that's close to your schooling, go ahead and apply. I know for a fact that a lot of the doctors that we interview and we bring aboard were assistants with us in the past, and they liked how the model worked. So it's a good way to make a little extra money and see how Aspen works. So if you can see if you're comfortable in that setting for after school. So apply. I know there's not going to say, no, we're not going to hire you, but you're still a candidate just like anybody else out there. Mm-hmm. So I would say go ahead and apply. And I would say we'll probably want you to come work for us. So you might even have a higher leg up because you're going to be a doctor eventually. So great question. What are some things you would suggest for applying to dental school, or I guess main focuses when applying? I'm not sure I understand that question. Well, I'll
Like,
change it. I'll change it then. What are some of the things that you as a lead dentist look
mhm,
for in maybe an associate that's coming into your practice? Or
okay.
when you were going into an associate role, what are some of the things that you wish you would have known more of?
Yeah, so I started with Aspen as an MCD, but being an associate when I was in private practice, you know, you're kind of naive a little bit. You're used to what you used in dental school and the materials, different things. And a lot of times in private practice, it is what it is. You get what you get. That's what the owner doctor liked, and that's what you'll use. In Aspen, if I don't like something, I try something else. I can try whatever materials, anything like that that I want to do, which is really nice. That's another thing. You have the autonomy to practice how you want to practice, treatment plan how you want to treatment plan. No one's once ever told me what to do in that aspect. I think if you can get into the office you want to apply for, kind of see the staff, see the office, that makes a huge difference. You'll feel right away like if that's somewhere you would want to work. Find out what materials they're using, what labs they're using, what are they keeping in house, what are they referring out. You know, does that doctor still go to CE? That's a big thing. You want to make sure he's going to mentor, he or she, I guess, would mentor you. I mean, you're fresh out of school. You want to be able to bounce ideas off of someone and not just have, you don't want to be stuck in a corner cubicle just doing fillings. You want to make sure that they're going to allow you to do bigger cases. So for me, when we hired my associate that's at my office now, she was willing. She wanted to learn. She wanted to try all different procedures. She was great with patients. Really seeing how someone interacts with patients is a huge deal for me. I am a mentor for Aspen. I've had a lot of doctors come through my office where I train them before they go to their office. And it's really eye-opening to see what's out there. So patient communication, how comfortable you can make them.
Good question or good answer. This one just came in. What made you shift from private practice to Aspen Dental?
Oh yeah, well, okay.
We'll get into
So here we go. There it is. So, okay, we'll start my first job. I ended up working for a dentist that turns out he was very old, addicted to pain pills, had a Medicaid office. If they had Medicaid and they had multiple fillings, we were only allowed to do one at a time on nitrous because each time they came in, we could charge for nitrous and the filling. Would do just horrible work. And I got to the point where I was like, I can't be associated with this. But then as a new dentist, I was like, how does that look if I quit my first job and I'm not even a year out of school? So I held out for a year because I felt like that shows you put some effort in. My next job was great. It was a wonderful man, but old school, wasn't big into new technology. Also, his wife ran the practice. So his wife at one point decided as an associate, I shouldn't be paid for certain procedures and this, that, and the other. Went to work for another dentist. He was very old and he decided if he built out his practice, more people would come. So actually, when I got on there and he didn't tell me, he actually lied to me. There was already two other associates. So I was the third associate, and there just wasn't enough work. He was doing Invisalign on people with broken teeth, root tips, anybody he could, so he could be a top 1% Invisalign. So again, ethical, you guys. I don't want to be associated with something that should not be done. I left that job and worked for a younger dentist. Thought, okay, he's younger. This is it. He ended up having too many DUIs and lost his driver's license and was doing implants without a CBCT. Had bought a very old office and didn't update anything to the point where it was I didn't even have my family or friends come see me there. And then I got to the point, honestly, where I was pretty depressed with dentistry. I had graduated top of my class, you guys. Like I almost went to ortho, I had a 4.0. I was like, I am a dentist. And then I kept running into all these problems and just thought, well, it's me. I don't know. But my roommate in dental school was a year younger than me. When she graduated, she moved back to Florida. She'd been with Aspen since. I called her and she was like, oh my God, I think they're opening in Virginia. Please just try it. Like, don't quit yet. And I said, okay, I trust her. She's been with them for over 5 years. She's smart. And I went for it, and it's been great. So
Wow.
really having to work for people that I didn't agree with their treatment planning, I didn't agree with things they were doing, I wasn't being paid fairly. I didn't feel like I was growing as a dentist because I didn't have the CE, and that's all changed now that I've been with Aspen. So that was a big difference.
Wow, you hit on a lot of things that that I hear about, but I never had to experience them. So let's talk about you in a practice, and you're an associate with
Mhm.
3 other dentists. And you said there's not enough work.
Yeah.
Talk about how that is done at a private practice
Yeah.
versus how much work is divided in your
Oh,
practice, and
absolutely.
how that works to the common goal for the students.
Yeah, so we actually just had this discussion the other day. So in private practice, you maybe get a daily rate and a percentage of what you do. Well, if you have 2, 3 other dentists you're competing against, I am not lying, this is a true story. One of the other associates would literally run down the hall to get to the hygiene room to the new patient so she could see as many as possible so she could get paid more. And she would scream at the hygienist if they let us go do those exams and treatment plan. So you're fighting for what's yours. You are literally in that same office. You had to check every single day at the end of the day that what you did got charged out under your name and not the owner's name. Because if it did, at the end of the month, when they calculated what you did, you weren't getting paid for that. So there were so many things you had to be aware of. Or the other office where they were like, yeah, no, night guards aren't going to be included, or remove things like that. At Aspen, with my associate, I don't keep big procedures for myself. Like, I want her to grow as a dentist. I don't get paid just off what I do. At Aspen, it is a group effort. It is based off the office. So I don't have that worry of like, oh, well, I can't give her this huge extract and insert case because then I'm not going to get paid at the end of the day. That's not the case. I'm helping her become a better dentist. She's helping the office. So I love that aspect about it because it takes that drama out of it. It takes fighting for patients out of it, worrying about how you're going to get paid.
Yeah, and it leads into the next question that just came in. What does an associate dentist start out as? And you don't got to go into specifics. I can give averages if you don't want, but what does an associate dentist fresh out of school start out with Aspen?
I know it can be different in different markets throughout Aspen. You do get a daily rate, so say anywhere from like $500, $600 a day, you're guaranteed. And then at the end of the month, there is what they call profit sharing, or what I just call my bonus. And that is going to be based off of what the office did production wise on an average with what was deposited, what you collected, which is normal. That's going to be private practice too. So they take the average of that, and from that they take out like set expenses like hygiene wages, assistant wages, what you spent. That's why I'm saying your budget on what you're ordering. And then you get a percentage of that based off of your patient loyalty score, which I just want to say my office was #1 in the whole company for 2020. So we were pretty proud of that. And that's a big thing. I tell people all the time, they base it off patient loyalty, which I think is great. The whole point, you don't want people to come into your office if you're working at Aspen and then feel like it's corporate. I want them to come in and feel like it's a family practice. It's just Aspen's on the door. So I like the way they do that.
Yeah, and everything she said is right. I will say that in most markets, the average rate is 600 now.
Okay.
Some of the older markets, the older doctors don't want to pay that much, but in most markets, it's 600. With, like she said, with the profit sharing. Somebody asked about benefits. You'll have paid time off, 401k,
Oh yeah,
insurance for you and your spouse. So it's just like working a regular job, except for there's going to be a doctor that's the boss. You're working under that doctor, and everything else is similar. So good questions. Keep them coming, guys. Earlier you hit on clinical autonomy. So kind of when you first started working with Aspen and seeing new patients, did you have any quotas or
no, never.
goals you had to meet, or kind of walk them through
Yeah.
what a new patient visit looks like.
So I'll be honest with you. We just had, like I said, those two new dentists kind of come shadow, and they had heard some misinformation about Aspen that I had to clear up about that with quotas and this, that, and the other. I had a friend that worked for Heartland. I can guarantee you when you go there, they give you a budget you have to meet. If you don't meet it, that deficit follows you into the next month. That is not the case at Aspen. They give you a goal that you should meet every month. Do you get knocked for not meeting it? Not really. I mean, you're not going to get, you want to be above their goal if you want to make the kind of money you want to. But they're not going to carry any deficit with you into the next month. I've never been told, no, you haven't done enough crowns this month, do more crowns. You need to do this. Literally, no one has ever told me how to treatment plan. Now, one thing with Aspen that's great is they obviously they're going to track everything you do. And it's really eye-opening to see, okay, how many 4 surface fillings did I do compared to crowns? You can see that, and you can really judge what you're doing off of that. They're going to break everything down for you. You know, and they're big on comprehensive treatment planning. I would say that's probably the biggest thing, which I don't have a problem with. You don't want somebody coming in for a limited exam. You can't help them if you're looking at one thing. Maybe get them out of pain and then do the new full exam. Yes. But no, there's never been, no one's ever told me how to treatment plan, fussed at me for that. If it wasn't comprehensive, yeah, they're going to be, you know, upset about that, because that's what patients are coming in for. You want to give them options and you want to give them a full plan, but they're not going to tell you to do one thing over another.
Perfect answer. This question just came in. What are the hours like? So I guess we'll go over what your practice's hours are. And then they said, do you work in one office or more than one office? And what does a general day look like to you? I guess maybe go over kind of cases, new patients.
So my hours at my office, Monday through Wednesday, we are 7 to 5. Thursday, we are 9 to 7, and Friday, 7 to 12. There is one Saturday a month that is 7 to 2 or 8 to 3, depending on the doctor's preference. When there's 2 doctors in an office, you can switch off every other month, or however you guys figure out how to do that. Generally, if you're working that Saturday, you can have a day off during the week. So you're not working, you know, 6 straight days. At least that's what we're doing in my office. I don't want to be a horrible person, because I've worked at places where I've worked 6 straight days for that. And my general day, let's see. So I have my own production column. My associate has a production column. Hygiene has their own. You have a full column of new patients. And then I have what's called an overflow column, which is going to be like crown deliveries, denture steps, things like that.
So yeah, and I think that would be standard for most offices. You know, it's anywhere. It can be 8 to 6. Or you said 7 to 5, 8 to 6, and that's changeable. It's all going to be the same. I think it calculates to about 37 working hours with your lunch break, and then if it's not a Saturday week, obviously. So yeah, that works out pretty well. How long does it usually take before an associate becomes a lead dentist? Or how did you know that you were ready to become a lead dentist?
As far as like new grads coming out of school, I think that's based off of, I mean, your work, I guess. I would generally say at least a year or so before somebody would become an MCD or managing clinical director. I had been practicing for 6.5 years before I came to Aspen. I was not going to be an associate. And that was just kind of what I told them when I applied. Oh, and also I only work out of one office. I don't travel to different offices. Some people might do that, but that's not the case for me.
Is it realistic for an associate to not work any weekend hours at all? Maybe do 2 long days during the week in addition to 3 regular days?
I mean, that would probably be up to your MCD and your owner there. You know, they're going to look like, I mean, for me personally, if my associate was like, I don't want to work a Saturday, I'd be like, okay, well, I've been practicing 9 years and you just got out of school, so you might have to. It's just, you got to think of what's fair too. I think it's It's only a few hours. It opens up to patients that can't get to you during the week. That's the biggest thing. It's access to patient care. It's not about whether it's a free weekend or not, or longer hours during the week. They might just physically not be able to come see you during the week. But again, it would be up to that practice owner and that doctor how they felt about it. But it's a standard across Aspen. There's going to be one Saturday open a month.
Well put. You might not know this one, but we want all the questions. How hard is it for you to move from one Aspen location to another that is in a different state?
So, that's just about open communication. We have doctors that do that. Life changes. Maybe you want a different opportunity and it's not available in the state. So it's being open with your regional manager, your owner, your MCD. And if they know you're open to moving and you're not just like leaving them high and dry, they're going to help you do that. Like I think they would love that if people were open to moving to new markets when they're ready. Because if you look at it, you go for an associate position, depending on what state you're in, what area you're in. If there's not an MCD position available, like, are you willing to move? And if so, I guarantee they're going to help you figure that out.
Yeah. And I think that's normally what you'll see is, Florida is one of my markets in District 5, and they don't have a lot of openings. And so a lot of the times we'll hire associates in Alabama, Georgia, or anywhere around there so that you'll come in, practice your skills, get good. And then as soon as the MCD position opens where you want in Florida, you're at the top of the list because you already know our model. You've already know what we're looking at. So that'll be the main reason, but it's not hard. And if it's a lateral position, your wife got a job or your husband got a job in Texas and you need to find a spot in Texas. Well, we just need to find your replacement at your office, and then hopefully there's an opening at a location in Texas. It's pretty easy and it's not uncommon at all.
Yeah, and they're really willing to help if you're open about that communication and don't just obviously if you throw something on someone last minute, that's going to be hard. But I've known a few people to move to different offices, not only because family and things like that, but you might not get along with the dentist at that office. You're a great clinician. They don't want to lose you, and they're going to help find you a place that you would better fit in, better grow. I have definitely seen that a few times in my mentor program. I've had some people come through and I've known the doctors where they were going. And, I was like, I don't think this is going to be a good match. This is going to have to change. And they look into all that. They take that into account because they're invested in you. So open communication is the biggest thing.
Yep. Good questions. Keep them coming. Let's see. Is the 600 a day standard across the country in any state, or would more saturated West and East Coast have different compensation? If so, could you say how much? I'll answer that.
Yeah, I don't know.
With Aspen, it's not, if Florida, we're going to pay less in Florida because no, we don't really believe in that. We want you guys to feel wanted. So like I said, 600 is really the standard across the board. Like I said, in some older markets, I've heard of some markets in Pennsylvania that the doctor said, I'm not paying more than $550, and he's the owner, so we're not going to do that. Also, I've heard in some markets that are hard to fill, like North Dakota, they might pay $800 a day. So like I said, the 600 is the average for most markets, but you're going to see some one-offs depending on where you're looking. So
yeah, and I mean, back to that, it's your daily rate. You're pushing to make your bonus. And that's going to be private practice or DSO, whatever. Granted, yes, we all want to be paid a lot, but you also have to be realistic about what are you going to be able to produce and bring in as well. Because it's dentistry. We're here to help patients, but it's also a business too. So you got to think, getting a flat daily rate is great, but you should really be striving for the bonus. Come here.
Good. Let's see. Okay. Good question. If you are an MCD, are you required to buy into the practice?
No.
Do you have that option? And if so, could you elaborate on that a bit? And what will it generally, at what point do lead dentists decide to buy into the practice?
Yeah, so that depends. Obviously, it depends on if it's if you have a practice owner or if it's a large group practice. Large group practice means like Aspen owns it. There's not an individual dentist that owns that practice. No, you do not have to buy in. If that practice owner wants you to be a partner, you guys have that discussion, and it's got to make sense for both of you to do it. Generally, I think when you buy in, when you start the buy-in, I think it's at like a third or 30%, whatever. And it can be more. It's all dependent on that doctor and what percentage they're willing to have you buy in. And that's really a discussion generally, probably, after you've been there for a while and they know you're going to stay around, you're happy, you can, but no, you don't have to.
Yeah. And like she said, I would probably say 60 to 70% of Aspen's practices are already owned. So you'd be looking at a partnership. But if, like I said, we're in 43 states, we plan to hopefully be in all 50. If you want to be an owner and not just a partner, you may have to move to a newer market that's less saturated. But those questions, you come in, you learn the model, you learn the business. It doesn't take long for those conversations to be had.
Yeah.
At that point. So, okay, Doc, I got a question.
Yeah.
You mentioned you've mentored a couple doctors.
Yes.
What does that mentor, or I guess you bring in, they get ready to their office. I guess when we hire a doctor and they come in, let's say they say, Dr. Fopp, we need you to get, I guess what do they call it? The first 4 weeks of.
Yes.
I don't know what they call it, but tell the students what they can look forward if they were offered a position, accepted it. What would their first month look like?
Yeah, so I don't know if they call it the doctor development program still or what, but it's about 4 weeks. And in my office, I help. I'm trying to think now. It's been a while. Really learning the Aspen Dental system. I mean, the online system first, like our charting system, walking them through that, walking them through what the metrics is, like I was telling you guys, how you can track what you're doing, see everything, walking them through the schedule, the flow. Probably the first week or so, I have them follow me through how I would do things, like my full schedule of operative, new patient, overflow, what I'm doing there to manage that. And then when they feel comfortable, start having them do procedures, having them build upon that, building their own column. I generally don't have them do new patient exams for a while. I leave that up to me so they can focus on just doing the actual dentistry, working on their time frames. That's another big thing, is when you first get out of school, working on your time frame, where can you get faster, and really helping coach her there, letting her build that schedule, but saying, hey, give me this much time for this, but let's shorten it the next time I do it. I want to see how I'm doing. All the lab steps, coming out of dental school, there's a lot you do that you're not going to do in the real world, for as far as removable things, the Aspen way of things, going through our lab scheduler. It's really just getting you comfortable with being in an office, real world practice, and not just throwing you in and expecting you to manage 5 columns and.
Thank you. Yeah. So I think it still is called doctor development. And I know you'll do your first 4 weeks, your first couple of weeks, from what I understand, you're not even really working. You're just shadowing the mentor doctor. And then you start getting your feet wet and you're doing procedures. And then over the next 3 to 6 months, we'll bring you to Chicago, which is where our headquarters are. And we'll give you a week of training where you get CEs, get to know some of the the doctors there. So there's a lot of that goes into it to get you comfortable in your position. So good questions. Can you talk, this question didn't come up, but I always like you guys to discuss it. What kind of things did Aspen do during COVID to get you guys through the pandemic, so to speak?
Well, in my area, we kept 2 of the offices open, because in Virginia, for about 6 weeks or so, we were only allowed to see patients based off emergency. If you did anything that wasn't considered emergency, they could fine you, take your license, all things like that. But we did keep 2 offices open. We rotated dentists through them, because you obviously couldn't have that many people in the office either. So to try to make it as fair and keep people working, we had the dentists rotate through. I would say the majority of assistants didn't want to work. I mean, to be honest, people wanted to sit home and get unemployment. So
Yeah.
the ones that did want to work had the opportunity to, and Aspen had a big deal with getting us the PPE we needed. We honestly, my area, we never had to worry about it. We had face shields, we had N95s, we had gowns. So they really made sure to get that out to the offices. They even sent hand sanitizer when they could find it, all different things.
Good question. Yeah, it's a lot of the doctors say that being at a private practice, you would really have to be at a disadvantage with the PPP or
Yes.
PPE and all that stuff. So, just like to mention that being in a part of a big company, it sometimes has its benefits. You mentioned we should focus a little more on the bonus or incentives we could make. Is that based on the quantity of patients we could do? If so, what would be a ballpark percent per patient it would look like?
No, it's not based off that. And I guess what I was trying to get at there is you don't want to just rely on your daily rate, right? Like, it's there, but if you're only making that, you're not really doing much in your office. Like, so with the bonus, it's based off the total production of the whole office. That's why I was saying it's a team approach. It's hygiene. It's what I'm doing. It's what my associates doing. So we really strive for that. I mean, obviously we want to get patients out of pain. We same day start people. That's a big term that we use. So I just meant you have that bonus there. Like the daily rate is great, but to me, like I know I kind of gauge how my month has been because I'm like, okay, how many people did I see? What was I able to do? How much dentistry did I do? If I'm only making my daily rate, I wasn't really performing is how I see it.
Yeah, and it benefits you guys as associates. That the doctors that come in for them to develop your skills, so you guys as associates can produce more, and you guys supporting the hygienist and the lab techs, and like she said, it's all working together. So everything that a lead dentist does, associate, the hygienist, everything that you guys produce is
Mhm.
all put into that pot. You take out the wages, the supplies, the lab fees.
Mhm.
Then after that pot, everybody gets a percentage of that. So you guys want everybody to be successful as a team in the practice.
Yes.
So, oh, this is a good question. I haven't had this one before. Any advice for someone who's getting an Aspen offer?
Getting?
Yeah.
Oh, yeah. I mean, fantastic. Like we talked about, it's not really a contract, it's an offer letter. I mean, there's no non-compete. I would just say if you're getting an offer, maybe ask if you haven't been to that office to see if they can get you to that office to shadow for a day and really see what it's like. That would be my biggest thing.
Yeah. Congratulations on the offer.
Yeah.
I will shout out that we are doing our second virtual vibe with the pandemic, where we get you guys, we'll get D4s. I don't know how many guys are D4s, but you guys have the opportunity to get in front of owner doctors who have open positions, and hopefully extend offers. If you guys hit it off, and everybody who accepts an offer at virtual vibe, it's on February 6th. There is a $10,000 sign-on bonus. So if you are a D4 and you're interested, reach out to me. I'll get you all the information you need. So, well, good. Congratulations. That's great news.
Yeah, so I know there was a question off to the side in that little chat thing that said, what are there loan repayment or sign-on bonuses? It's not the military. There's not a loan repayment. So I think if you want loan repayment, you could join
Well,
this.
there's loan, there is loan repayment now,
Oh,
but it's based, like I said, it's based on the practices we can't find doctors for.
oh yeah. So
If
you're
you're
talking,
interested in like North Dakota, or they're mainly in the Midwest. If
yeah.
you're interested in the Midwest and you that's a big part, we can get you to the right person to discuss the loan repayment and stuff like that. So
Well, yeah, there are some places that I don't know if it would be worth it to pay off my loan.
so it just depends on what you're looking for. Um, okay, this is a good one that just came in. What kind of thing does Aspen do to give back to the community?
Oh yeah. So there is the mouth mobile that's obviously been changed right now because of COVID, but it was this huge bus with basically 2 or 3 operatories and an X-ray unit in it, and it went around to treat in need veterans around the country. So it did me and Dr. Turkowitz actually did it not 2020, but 2019 because it came to Virginia Beach. Virginia Beach, Norfolk, we have some like the largest I don't know, military bases here. So that was really cool. They came there. We also do, what is the Veterans Day called? There's like a specific day.
The free day of service.
Yeah, the day of service.
Yeah.
We're in each office. It's a full day. Everybody works. It's a volunteer day. You're not getting paid to do this day. It is volunteer doctor's time, hygienist time, assistant's time, to see veterans in your office to do work for them that they otherwise couldn't necessarily get, because veterans do not get dental care unless they're 100% disabled. So that's very hard to get. I can tell you, my husband's in the military. So if they're not 100% disabled, they're not getting dental coverage at the VA, and that can be really tough on a lot of them. So it's a great day. I think one of the greatest things is we made dentures for a guy that hadn't had them in years, and just knowing you could change someone's life so they do a lot with the veteran community. I know they've done, and each practice can do their own thing. I've seen dental practices, different Aspens, get together and make bags for the needy, the homeless. Different practices do stuff for underprivileged kids. My office this past year, because of COVID and we weren't doing day of service, my husband was deployed, but there was a lot of guys with him that didn't have family, didn't get anything. We collected enough to send like 10 huge boxes to all the guys that didn't have family. So it's really, you can make it and they'll support you with that. So it was really great.
That's awesome. And a lot of the stuff we haven't been able to do with COVID.
Yeah,
so
COVID's really changed.
Yeah, so we'll get back to it when hopefully Pat gets past this. So
yeah.
You may not know this one, but we're going to ask it. Do the internationally trained dentists, after having done DDS, fall into a different tier? Also, does work visa status get affected in terms of it being more easy or harder to get?
What is a tier? Can that person?
I think internationally trained, so would be somebody who was a dentist in their country. But
right. Oh, I mean, I'm going to be honest with you. There have been plenty that I've seen come through that went back to dental school. Are we talking about if they went back to dental school in America?
Mm-hmm. Because I think I've seen that a lot where there's not a such thing as a tier, so to speak. But when you graduate dental school, if you've already been a dentist for so long in another country, you may not be an associate. You may come right in and be a lead dentist. So
yeah, I've seen that happen, but it's really based off the individual person. I'm going to be honest. I've had multiple people come through my office that were internationally trained and came back through and did the program. There were some that I didn't think should have been a dentist in any country. And that's based off each person. One of the girls that came through, she went straight into being an MCD. So that's really individual and kind of your portfolio, what you're capable of doing, what that doctor thinks you're capable of doing. But I don't think, I mean, they're going to look at that case by case basis. Just because you were a dentist elsewhere doesn't mean that they're going to just take that at face value.
Yeah, and it is case by case basis. And if you're in a dental student who's just graduating, but you think you're ready for a lead dentist, go ahead and apply for them. Let them know your interest. I mean, what's the worst they can say is no.
Right.
So it just depends on the person and where you feel comfortably with your skills. This question just came in. What kind of technology does Aspen Dental Management do for the practices that we support?
Oh, so I mean, like the dental technology, I can tell you, like almost all new offices now have a cone beam CT with the SMOP software to create surgical guides. Every office has an iTero scanner, so you can do digital impressions for your crowns, your partials, Invisalign. It's all really up to date. All the x-rays are digital. Your charting's digital. I don't know if I missed anything there.
Yeah, I think you hit the nail on the head.
Yeah.
Can you talk a little bit about what Aspen did for you guys as an office when we rolled out Invisalign?
Oh yeah. So they sent the MCDs and a hygienist and assistants to Invisalign training. Obviously it's different now, COVID. But they have great orthodontists in charge of the Invisalign program. So when you have cases and you have questions on it, you talk to an actual orthodontist in the company to help you really plan that case if there are any issues. So they want to be on top of all the new technology. I mean, in this day and age, you can't really be a dental practice that's not doing that, because that's what patients are expecting.
Yeah. Now, Dr. Fopp, do you do implants?
I can. Yeah, we do. My owner sent me to attend, I don't know how many, a week, 10-day implant course down in Mexico. So each owner is different. That's going to be based off of, but now, doesn't Aspen have their own implant training course? Aren't they doing that?
Yeah. So you see, I think they purchased a building in Chicago where they're going to bring a lot of the
Yeah.
doctors in to complete the final stages of the implant training. But we hired Dr. Rawal to run our
Yes.
implant training program, so that most of our general dentists can not only restore implants, but by the end of the training course that he's designed, we'll be placing them. So
Yeah. So yes, I can place them. I can restore them. Obviously, I try to be picky and choosy about it. I'm not a specialist, and I want that patient to have the standard of care. So we do have an oral surgeon that comes to my office about once or twice a month for some of those bigger cases and things like that. Oh, I forgot to mention that there is an oral. Most offices are going to have oral surgeon that comes.
that was going to be my next question.
Yeah.
So what kind of, so tell the students, what kind of cases do you send to the oral surgeon, and the benefits of having that oral surgeon that comes in once or twice a month?
So for my oral surgeon, he does sedation, he does nitrous. And so basically the cases he's getting is anybody that needs sedation, any crazy wisdom teeth. I'm not taking out impacted wisdom teeth. I'm not taking out partial bony. I'm just not going to get into that. If people need sinus lifts, that's what he's doing too. Huge tori removal, I'll do smaller mandibular tori removal, but anything too big, it's going to be on his. Again, for me, it's the standard of care for a patient and what I think is the best for them.
Do you guys have a endodontist?
No, our region, we do not. There are a lot of offices that do. Any molar or multi-rooted teeth, I do refer out. Just, that's not something I want to deal with. There's enough problems with endo already that I just don't get into that. But if you want to do it and you're good at it, you have the option to do it. There's a CBCT in the offices now, and if that's something you enjoy, more power to you.
We'll finish with this question, and then we'll do our drawing.
Yeah.
What is something you wish you would have known coming out of school that you know now that you would like to relay to the students?
Something I wish I knew then. I think being confident is a huge thing, and being true to yourself. But for you guys coming out of school, being confident in front of those patients, if you're doing treatment planning, if you're doing any work, I still get to this day, oh my God, how old are you? Should you be practicing? So I think that's the biggest battle, is instilling confidence, especially if you're going into Aspen and fighting against that whole corporate name or looking young. Yeah, I wish I had known, like, to really just be who I was and believe in myself. You guys have the training, you know what you're doing. Penny, come here. Sorry.
It's okay. Okay, so we'll conclude it there. Thank you, Dr. Fopp, for all this useful information. I'm going to have you pick a number between 1 and 34.
Oh, 1 and 34. Okay, I'm going to go with 13.
13. Okay, so the winner of tonight's Apple AirPod giveaway is Joanna Hahn. So congratulations, Joanna Hahn.
Woo!
I will be reaching out to you via email, getting your information and sending those out to you guys. If you guys need anything else, reach out to me. I can give you some information about anything we talked about tonight.
Yeah,
And
if you want my
Go ahead.
email, I can give you my email if you guys have questions. And I mean, I'm an open book. I don't know Aspen anything. I don't know private practice anything. So if you have a question, I'm here to help.
Yeah, so I can get that information to you as well. So we'll let you guys go. Again, thank you for giving us the time tonight, and I look forward to speaking with some of you guys, okay?
Yeah, good luck.
Thank you, Dr. Pop.
Bye.